Hello, my name is Joel Moore, and today we're going to learn about Alprazolam, also known as Xanax. The purpose of this presentation is to provide a clear, evidence-based overview of the effects, misuse, ingredients, and the safety of Alprazolam. During this presentation, we're going to go into what is Alprazolam, what the users feel, the medical uses and legal status, the misuse and overdose data, as well as dependence, withdrawal, and the interactions. Alprazolam, commonly known as Xanax, most of you may have heard even the term Xanibar, is one of the most prescribed anxiety medications in the US. However, misuse and overdose rates are rising. What is Alprazolam? Alprazolam is a benzodiazepine. It is a central nervous system depressant used to treat anxiety and panic disorders. The chemical name is 8-chloro-1-methyl-6-phenyl-4-hydra-S-triazo-4,3-A-1,4 benzodiazepine. The ingredients that go into it are lactose, cornstarch, cellulose, magnesium stearate, docusate sodium, and sodium benzoate. So what users feel? Utilizing therapeutic doses, patients or persons will feel drowsiness, slow thought and movement, mild euphoria, as well as reduced anxiety. There is a risk of impaired memory, judgment, as well as coordination just with therapeutic doses. Now, with the misused or excessively high doses, people are going to experience strong feelings of sedation, disorientation. Sometimes patients or persons will black out. It's called retrograde amnesia. There is an increased risk of overdose, and usually it's accompanied with alcohol or opioids. For the medical uses and legal status of Alprazolam, Alprazolam is approved for generalized anxiety disorder. It's also known as GAD, as well as panic disorder. Now, in terms of classification, Alprazolam is a Schedule IV substance or medication. And what that really means is that it's only available by prescription with potential for abuse that is above minor and is in the moderate category. Now let's look at the misuse demographics for Alprazolam and other benzodiazepines. So in terms of emergency visits, there were over 17,000 ED visits that was directly linked to non-medical use. Now that's 51% of those are female, and with an age range 20.9% were between the ages of 25 and 34. Regarding overdose deaths, there were 11,537 benzodiazepine-related deaths, and that was in the year 2017. 85% of those involved the use of opioids as well. Now, the common source of misuse is essentially family sharing or friends and using leftover medications from a different individual. The dependence, withdrawal, and interactions for Alprazolam are as follows. In terms of drug interactions, it is very dangerous with opioids, alcohol, and barbiturates. And the risk there is respiratory depression or decreased breathing, as well as coma and death. Now, the withdrawal risks are seizures, psychosis, which is an altered mental status, insomnia, nausea, and agitation. And dependence can occur just within a few weeks. To summarize, Alprazolam is effective for anxiety and panic disorders. However, misuse is widespread and can be deadly. These are the references that were used, and thank you very much.